Hello, thank you for tuning in to learn about the results of the first COVID-19 survey we conducted on COPD360 Social. My name is Delia Prieto, and I'm the Senior Director of Research at the COPD Foundation. To start off, I'd like to give a brief overview of COPD360 Social, which is the main platform where this survey was promoted. COPD360 Social is our global online community for individuals affected by COPD and their caregivers. There are over 47,000 members registered on social, nearly 50% of which are COPD patients. In addition to patients, members also include caregivers, family members and friends of people with COPD, and healthcare professionals. COPD360 Social includes members from over 150 different countries, and the 5 countries with the highest representation of members are the US, United Kingdom, Canada, Australia, and India. The COVID-19 survey we conducted was an online, anonymous global survey that was created with input from our international medical and scientific experts. The survey was promoted on COPD360 Social, which I just gave an overview on, as well as Bronch and NTM 360 Social, which is the online community for people affected by bronchiectasis and non-tuberculous mycobacterial lung disease, also known as NTM lung disease or MAC lung disease. The survey was open from March 29th to April 13th, and during this time period, 566 people completed the survey. One unique and exciting thing about this survey is that it was the first time we used machine learning or text analytics to analyze the comments provided by the community. This allowed us to fully understand what patients are feeling during this time of crisis. This is a snapshot of the survey participants. We've broken them out into 2 separate categories, those with COPD, 513, and those without COPD, 46. In those with COPD, there were 80 respondents who reported having bronchiectasis. And for those of you who may not know, bronchiectasis is a lung condition characterized by the abnormal widening of the airways in the lungs. It causes cough, sputum production, and repeated lung infections. There were also 11 respondents who reported having an NTM lung disease, and 16 who reported having bronchiectasis and NTM lung disease. 225 of the COPD respondents also reported using supplemental oxygen, and 177 reported experiencing at least 1 exacerbation during this calendar year. For those without COPD, there were 2 respondents who reported having bronchiectasis, 1 respondent who reported having NTM lung disease, 12 respondents who identified as caregivers, and 18 respondents who identified as healthcare providers. The survey included questions specifically about COVID-19, including symptoms, diagnosis, testing, and hospitalization questions. This is the heart of the COVID-19 data that we collected in the survey. Results show that 16 people were told by a healthcare professional that they had COVID-19, but you will see that a smaller number of people, 6 of them, were actually tested for COVID-19. Of the 6 that were tested, 2 of them tested positive, meaning they were confirmed to have COVID-19, and both of them were hospitalized for longer than 1 week. One of them was even in an intensive care unit for longer than a week. These results are consistent with other data on COVID-19 in showing that incidence, or the rate of new cases of the disease, is not higher in people with COPD, but the outcome tends to be worse. The results also show that testing is underutilized in the COPD population because 177 participants reported experiencing an exacerbation during this calendar year, but only 6 of them were tested for COVID-19. In this survey, we also asked respondents to share the COVID-19 symptoms that they experienced. The symptoms were reported as free text responses, meaning they were typed into a comment box. And this is one of the ways we use text analytics and machine learning in analyzing the survey data. This word cloud depicts the results of applying free text analytics to the responses. The larger the word, the more frequently it was provided as a response to the question. So for example, you can see that fever and cough were commonly reported as symptoms of COVID-19, whereas nausea, foggy brain, and headaches, for example, were less commonly reported symptoms. In the survey, we also asked about medications being taken by participants because continued data collection on medications will help us to better understand how patients are being treated during the pandemic. In the medication section, we asked participants to share their concerns related to medications during the pandemic. And in response to this question, we found that sentiments most commonly expressed were related to general anxiety, fear, and isolation people are experiencing. Some also expressed concerns about healthcare provider availability and drug shortages, and a few expressed concerns about drug costs. This part of the survey was very informative for us because it reiterated that the work we're doing at the foundation is helping to address the needs of the community, but we clearly need to continue doing more to help reduce fear and anxiety. Our research and medical team is supporting our medical and scientific community by providing a platform for them to share knowledge and resources during what seems to be an ever-changing landscape around COVID-19. Additionally, we are discussing opportunities with our corporate partners that we hope will improve and maintain access to healthcare. And lastly, we're writing grant proposals on COVID-19, telemedicine access, and patient needs to continue providing support to our community during this pandemic. From this first survey, we've learned that the results related to COVID-19 are consistent with emerging COVID-19 data, in that the incidence of COVID-19 is not higher in people with COPD, but the outcome is worse. And based on the data from COPD patients who experienced an exacerbation this year, we see that testing is underutilized in the COPD population. We're now doing work to understand why this is. We have also learned that community members are anxious and fearful, so we will continue to provide them with the well-being and educational support they need during this pandemic. In looking ahead, we are about to launch survey number 2 and are hoping to get answers from those who responded to survey number 1, as well as responses from other patients and caregivers. We're hoping to get more responses in this second survey because in addition to repeating the questions from survey 1, we also added new questions on topics such as demographics, changes to daily routines like diet, exercise, and doctor visits, and questions on programs and services of need to the community. Lastly, but certainly not least, we'd like to thank everyone who shared their experiences and sentiments by completing the first survey. Please know that your responses are contributing to important research and helping to guide us in the work that we do. We hope you will continue to share your experiences with us. Thank you. I will now pass it on to Sarah Latham, who will highlight the COPD Foundation's efforts in response to COVID-19, which we hope are helping to reduce fear and anxiety among our community members.
Thank you, Delia, so much for your important remarks about this survey number 1. And I also want to thank all of the members from our community, from our patients to our caregivers, for participating in this important work. We hope that you'll continue to work with us on our upcoming surveys. I just wanted to take a few minutes to make sure you are aware of the COPD Foundation resources for our community during the COVID-19 pandemic. The first thing that we wanted to share with you is that we have a COVID-19 webpage that is devoted to the most up-to-date information about this pandemic. And you will see here on this slide the way to access that page. I also want to share with you that we regularly update our COPD Digest blog with information both about COVID-19 as well as how to handle this pandemic and your health status. The blog includes question and answers, and we do our best to make sure that we are staying up to date with all the information that we can bring to you. We also are working on live and recorded programming, such as this webinar that we're bringing to you today. If you haven't had a chance to review some of our presentations from the past, I urge you to check out some of the webinars that are listed here. Something that might be of interest is the March 26th webinar that addresses emotional well-being during this incredibly stressful and anxious time. Secondly, I wanted to share with you that we are making sure that we're leveraging your shared experiences and data so that it can help inform treatment decisions for individuals with COPD and COVID-19. And we are also considering important questions that need to be answered as it relates to COPD Foundation research and networks. Lastly, we all know that policy is an incredibly important issue for us to be addressing. And you will see that we are working to expanding coverage and minimizing out-of-pocket burden for our community, facilitating more virtual care for ongoing COPD management, looking to remove barriers to backup medications, and also making sure that we address the nonprofit situation as it relates to the economic stimulus packages. I would urge you again to make sure that you continue to check back on COPD360social for updates, conversations, and support, and to also look at the resources that we're continuing to provide you during this time. In conclusion, I'd like to share a note from Corinne Costa-Davis. And again, I want to thank you for participating in this presentation and for continuing to share with us your thoughts and feelings during this time. Be well, and thank you again.